Well, I had cataracts and I could not see at a distance. I couldn't see close up. I was wearing readers and they kept getting stronger and stronger. And I decided to come see a Dr. Proctor. I work here and I heard great things about him.
Well, one of the most common procedures we perform is cataract surgery. And at Gottlieb, we offer the full range of implants that are used during cataract surgery. Traditionally, like 10 years ago, all we had was a lens that would focus for people in the distance. And now we offer lenses that'll be what are called multifocal lenses, where you can see in the distance, you can see intermediate, which is like computer distance for people, and then you can also see up close. And then a third type of lens that we use is a toric lens, which is an implant that is used when people have a lot of astigmatism. So with the combination of these three lenses, we're able to solve a lot of vision problems for people and get them out of the need for glasses.
We talked about what type of lens that we were putting in, and I decided to go with a multifocal.
She was a great candidate because her job requires many different distances to see well. She's an ultrasound tech, so she has to constantly keep looking at the computer screen as well as looking up close at the keyboard. So with the multifocal lens, she's able to do all that without putting on glasses, which is fantastic.
It was simple. Of course, you know, the very first one, I was nervous about it, but it was easy, no pain, very fast. I think Dr. Proctor had me in there 5 minutes, 10 minutes.
A cataract is when the lens inside the eye is clouded. The lens sits right behind the colored part of our eye, which is called the iris. So our goal in cataract surgery is to remove that lens and replace it with a clear implant. And how we do that is by making a small opening on the side of the eye. We put an ultrasound probe into the eye and we break up the lens with the ultrasound and suck it out at the same time. Once that lens is removed, we can then fold an implant in two and we slide it into the same spot where the lens was. And this is a depiction of the implant in position. And at home they have to use eye drops. For the first week we use the eye drops usually 4 times a day. And then after that we cut way back on the eye drops and, until the bottles run out typically. As far as activity goes, the day of the procedure people aren't allowed to drive. Because of the anesthetic. But the next day they're up on their feet doing whatever they want to do. They can go back to driving.
How's the vision?
It's good. It's been great. I can read close up. In fact, I can zip through a book now much faster than I could before. I can see my screen, I can see my keys, I can see everything now.
Rose is doing great. She is glasses free. She's able to see her intermediate, her near, and her distance very well. She's 20/20 vision. She healed up very quickly after the cataract surgery, and that's kind of what we expect.
Anyone who's considering it, go for it, because it's a once-in-a-lifetime thing and you're going to be happy.